start with, I went through credentialing. It's probably back in, I think 2013 around is when I finished credentialing. And then I went on to the diploma program. From there, I went on to fellowship training and that finished up in about 2017. So I've kind of gone through a process of sort of continuing education above and beyond the credentialing level. It's been a really wonderful process for me. The people I've met, the people I've had an opportunity to learn from, it's really helped my practice even especially now given what's been going on, it's been a big help with my interactions through patients via telehealth, along with the usual interactions that we have in the clinic. So that's sort of been my journey so far to this point. We've sort of been in a gradual process, probably over the past month, kind of working towards telehealth. Like initially, there was a big drop off in the in-person visits for obvious reasons, and it took a good week or two to sort of get the infrastructure in place. For my company, I work for a hospital system, NYU Langone in New York, and it took them a little bit of time just to kind of get everything secure and able to be done in a professional and secure way. But once that took off, there was sort of a gradual shift from the in-person visits to the telehealth visits. So at this point, I still see some patients in person if they have either a more severe problem or they require more hands-on therapy, sometimes post-operative. I'll still see some patients in the clinic about 2 days a week, but the rest of my schedule has shifted to the telehealth. So that's sort of been the way it's gone, and it's probably the way it's going to be still for a little bit longer now until things settle down. Most of my patients have handled it relatively well, and I think given the fact that a lot of our interactions in person were really based on visual and auditory communication, I could sell this a little better to them rather than the patients who maybe are a little more used to a lot of hands-on evaluation and treatment methods. So, it was probably an easier transition for some of my patients. I've had other colleagues who've had a little bit of a harder time maybe getting their patients on board with this idea, and maybe having a little more difficulty with their treatment because it's a little bit different than they're used to. So of course there's some though who they can't wrap their head around this, and there's going to be a few that just don't want to do this. Either they're not technologically savvy, or they really feel that they need that in-person experience. But I would say the great majority of mine have been open to the idea, and they've had good experiences with it. So I think once that initial visit goes well, then they can kind of see that, yeah, this can work, and that they're a little more on board with it. I think one of the cool things about telehealth that I've found so far is that you are actually meeting the patients in their homes, and you're seeing really for the first time what their home life is like. What advantages there are there, and maybe what barriers and restrictions might be there as well. And it's been interesting because I maybe in the past in our face-to-face interactions wouldn't have understood exactly what their home setup was like, what would work or what wouldn't work as far as home exercises. So we can really go through what it is they have to do at home in a more realistic way. And I think that's actually been very helpful for their self-care and their home exercise program that we're working on. And in other circumstances, maybe in the past, I had an idea in my head and it maybe wasn't ideally set up for what I was asking them to do. So I think in that regard, that is an advantage of telehealth. And it really it makes it very realistic, your expectations for the patient. It's obviously very important to stay mentally active, but also physically active, and that's challenging right now. I've tried to stay productive, around the house as far as just doing, yard work and maybe some small house projects that I can do. You don't usually have all this extra time on your hands, so I'm trying to, use that time productively. So that way I stay active and I feel like I'm doing something productive. And I'll still go out for walks with my wife, just trying to keep the distance from other people. But I think it's good to get some fresh air and definitely get outside a little bit, even if you're not interacting with a lot of other people. And then, aside from that, I am trying to use the time a little bit to advance some of my education. I know the McKenzie Institute USA has done a really good job of putting out a lot of great content with their webinars. I happen to listen to Jason Ward's podcasts, the Mechanical Care Forum. Those have been really great. So I've been able to catch up on a few of those. And particularly for telehealth, I know that there was a webinar released by Mark Miller and Stephen Clausen that was really good, that I would recommend MDT trained clinicians take a look at if they're in the process of learning how to do telehealth or they're new to it like I am. I found their suggestions and education really helpful. And then aside from that, I'm actually doing some training with Mark's company, Integrated Mechanical Care. It's a little bit more geared towards the advanced MDT clinician, those who've been credentialed and diplomaed. But I found that training to be really helpful for those folks who are maybe at that level. A lot of the core tenets of MDT are really well suited to telehealth. Those concepts of classification based on symptomatic and mechanical response works very well through this medium. The thought of progression of forces, maybe not needing to put your hands on right away, but being creative with how patients can self-generate force and self-treat. Those concepts really work very well with telehealth. And I think because of that, my patients have been a little bit more inclined to be open to the idea. And then once we've actually worked at it, we've seen results, which I think is always the bottom line. And it's been fun to really see, that it can work for me. This is my first time doing it, and to see that it can work. And like I said before, maybe the advantage of seeing what life is like at home for them and maybe tailoring their treatments a little bit more specifically to that person, that individual. So it's been rewarding, for my patients and myself. And, I would encourage all those, who are going through their MDT training to really try to use this time to practice and hone their skills, get a little better with their communication skills and their listening skills as it pertains to your interactions via telehealth.